Let's begin and remember, act fast, save a life.
Every day, thousands of employees enjoy their lunch break at work. However, a simple meal can quickly become a life-threatening emergency. Choking occurs when food or a foreign object blocks the airway, preventing normal breathing. Would you know what to do if your colleague suddenly starts choking? Today, we will demonstrate the correct first aid procedure for choking management in the workplace.
Here what you will learn. Now, let's learn how to recognize the sign and symptom of choking. There are two types of airway obstruction: partial airway obstruction and complete airway obstruction. Understanding the difference between these two conditions is important because the first aid response is different for each. In a partial airway obstruction, the airway is only partly blocked, which means some air can still pass through. The person is usually able to cough forcefully, speak, or make sounds. Although breathing may be difficult, they are still able to get some air into their lungs. If this happens, encourage the person to keep coughing. Coughing is the body's natural and most effective way to remove the object causing the blockage. Do not perform back blow or abdominal thrust if the person can still cough effectively, as this action may worsen the obstruction. Now, let's look at complete airway obstruction. In this situation, the airway is completely blocked, preventing air from reaching the lung. The person will be unable to cough effectively, speak, or breathe. They may make silent attempt to cough, hold or clutch their throat with both hands. This is known as the universal choking sign. And their lips or face may gradually turn blue due to a lack of oxygen. This is a life-threatening emergency that requires immediate first aid. Remember, recognize whether the airway obstruction is partial or complete is the key to providing the correct response.
However, in this case, the casualty is unable to cough effectively.
Can you get up?
The first aider position, the casualty leaning forward. This position helps prevent the object from moving deeper into the airway. The first aider delivers up to 5 firm back blows between the shoulder blades. Each back blow should be checked to determine whether the obstruction has been removed.
Split it out. If back blow fails to clear the obstruction, give 5 abdominal thrusts.
do this, step behind them and put your arm around their waist. Place one hand in a clench fist between their belly button and the bottom of their chest. With your other hand, press your feet and pull sharply inward and upward up to 5 times. Check their mark again each time.
Are you okay? You can breathe now?
Yes, I'm okay.
Most dangerous workplace choking incidents are totally preventable with just a few simple daily habits. So, who actually holds the real responsibility for keeping everyone safe? Is it you or your boss? Well, it's actually dual responsibility between employee and employers. Employees should eat slowly and peacefully to prevent any choking incident. Chew food thoroughly, avoid talking while eating, and always take smaller bites. It's really that simple. Now, let's move to the behind-the-scenes prep required by the company management. First, provide first aid training, maintain emergency procedures, and encourage safety awareness.
In conclusion, choking can cause death. Early recognition, prompt first aid intervention, and rapid emergency response can save human life. So remember, recognize the sign, respond immediately, can save a life.